let's talk about the people who are in group practice and are thinking about starting their own private practice. What are the implications for non-compete agreements when you're thinking about, leaving, and how, what are ways to navigate that?
Yeah, no, and this is a very timely topic. So, what is a non-compete agreement is the first question. And a non-compete agreement is if you sign up with an employer and with that employer, they have a contract for you to sign. Often in that contract will be a clause that is the non-compete agreement that will say, hey, if you stop working for me, you're not allowed to set up shop within 20 miles for up to 3 years until you're done working here. And it's something that theoretically is done, to prevent people from joining a group, learning some trade secrets, and then taking all the knowledge you've learned on behalf of your other employer and just setting up your own shop. That's the quote fear. I think in reality, that's not something that really happens very much. And there are actually a lot of states, including California, that have always kind of banned non-compete agreements. But very recently, the Federal Trade Commission has ruled that all non-compete agreements are unenforceable. And it was something that I think was somewhat true regardless that these agreements were not very enforceable. But beginning in September of this year, September 4th, 2024, non-compete agreements among non-senior executives will no longer be enforced. And this is being pushed through because the idea is that these non-compete agreements have been bad for innovation and the start of new businesses. And I think they're hoping that they're saying non-compete agreements prevent maybe 8 to 10,000 new businesses each year from starting. And we know that despite all the big companies in the U.S., the 2/3 of all people actually work for small businesses or by themselves. And so that is what the backbone of the country's financial system actually is. And so I'm not a lawyer and I'm not an expert on this topic at all. I would say that there are some exceptions to where non-compete agreements are valid. So one was if you're a senior level employee, which is defined as making over, I think, $150,000 a year, which a lot of mental health clinicians will probably make over that amount. But if you're a policymaker or senior executive for a company, there can still be a non-compete. So if you've been in a group practice for a number of years and you're actually the chief operating officer, chief medical officer, or someone who makes policy decisions, be very careful about leaving and starting a business 2 blocks away. You can always talk to a lawyer and you can always talk to your current employer that if you're ready to leave, most employers don't want someone at their company that's not excited about being there. And maybe you can come to some sort of agreement and the reality is, Parker, in mental health, there is no shortage of patients to be seen.
Right.
We
Right.
have a way, way, way more demand than supply. So it always feels ridiculous in this field. Non-competes feel especially ridiculous in this field. I'd say the other example of non-competes have to do if you sell a portion of your company. So if you're in a group and you've had some shares of that group and then the group sells some or all of that to a private equity group, for example, if you receive distribution from that, then a non-compete can apply to you potentially through terms of that deal that you've received money as a buyout for selling some or all of those shares. So there's probably more. Those are the things that I'm familiar with. But the good news in general for lots and lots of other businesses, but also just for mental health clinicians as well, is very unlikely you have to worry about any non-compete agreement if you're leaving group. if you have been working for someone without a contract, which a lot of people do, or if your contract just specifies a couple of things and doesn't have a non-compete clause, then you really don't need to worry about that at all. And this goes back, this is a consideration if you're signing up with a group that is giving you a contract. Read it yourself, of course, highlight what
Always
seems confusing, and that is something that if it's a 10-page document with a lot of legal terms, it is worth having a lawyer look at it. I know that I increasingly became, as an employer, we used to have a very complex contract with a lot of legalese in it. And over the years, I thought it was more and more ridiculous, and it was wasting my time having to explain what these different clauses were. So we actually drastically simplified our contracts over the years. And, I don't think this isn't high tech national security secrets. Still, we're providing a service to people who are sick, and do we really need overly complex contracts? I don't think so, but